Regarding the plasma regeneration therapy, will the microneedling technique leave scars on my face? Will the microneedling technique leave scars on my face? My body has a tendency for low healing power, and even pimples leave marks on my skin. I have absolute lymphopenia in my latest checkup, so how does the needling part work for me?
Thank you for your question. You ask in your question the possibility of the microneedling technique with platelet-rich plasma and the risk of leaving scars on your face. And you describe, in the context of your question, your propensity to have difficulty with healing, that you tend to get marks and pigmentation issues, and then you end the question with describing a diagnosis of absolute lymphocytopenia. So I certainly can assist you in understanding the risks and benefits of this procedure. I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. I've been using PRP in the form of the vampire facelift, as well as on its own as an injection for improvement of skin quality, acne scars, fine lines, pigmentations, under eye dark circles, as well as in combination with the material called extracellular matrix for the treatment of hair loss in men and women. So I am certainly very familiar with PRP. And I think I can help you by giving you an understanding of how I make my decision on whether to do PRP as a microneedling device, with a microneedling device, or to do it as an injection or in combination. So let's start with that. First of all, if someone like yourself comes to our practice, the first thing we want to do is define the problem. You know, there are people who come who want simply complexion improvement. And when it comes to complexion improvement, I find that the injection of PRP under the skin has a tremendous value in creating a kind of a glow to the complexion. And I think it's based very much on the basic idea that PRP does stimulate the expansion and the vitality of the fat cells that are under the skin. And we all know that fat plays a very important part in the health of the skin. And you can just think about it. You look at a younger person, they have more baby fat in their skin. The skin has this nice volume and glow. And so what I find is for complexion alone, the microneedling is something that I would avoid and rather do the injection. When we talk about indications for microneedling, sometimes it's for very fine lines, sometimes it's for acne scars. But there is a flip side to that. There is also something more of a healing process, because with microneedling we're making tiny little openings in the skin, and so we get all of these little pinpoint openings that can have a little bit of bleeding, a little bit of redness, and although it heals pretty quickly, I mean usually 24 to 48 hours, the areas look very, very good. It also depends on the depth we set the microneedle to, and for what intention. Basically, the rule of thumb is the more deep we go, the longer the healing, the more the inflammation, but that's what you need for sometimes for more aggressive treatment, such as in the case of acne scars. When we're dealing with fine line, superficial pigmentation, we do it for like the chest area, the décolleté area, and for the face for dyschromias or pigmentations related to sun exposure in lighter skinned people. It can be of value because we're treating the superficial pigmentation. So I think in a situation like yours, if there needed to be some superficial treatment, I might want to do a limited test area to see how you do before putting you through the more extensive procedure. But it would be probably more likely that I would do the injection rather than the microneedling, because it puts you at considerably lower risk for these pigmentation issues and these healing issues. Of course, you also have to be completely worked up for your absolute lymphopenia or lymphocytopenia, where your hematologist, I should say, should be able to figure out why you have this and whether or not this is a short-term or a long-term issue. Because certainly we do need lymphocytes for the healing process. And so that has to be understood, and there has to be, I would typically I would actually get some information or maybe discuss this with the hematologist before doing something like what you're entertaining. So we have to look in the context of your situation with your blood and the situation with your sensitivity of your skin. So if there's no issue with the blood, I would probably go with the injection of PRP rather than microneedling approach. With that being said, I hope that was helpful, and I wish you the best of luck. Thank you for your question.